I've been having trouble sleeping.
Kayla, a 19-year-old student, sits nervously across from the crisis worker in a quiet room at the campus health center. She looks exhausted and hesitant.
I was raped 2 weeks ago by someone I met at a party. I haven't told anyone because I'm ashamed and afraid no one will believe me.
Based on Kayla's presentation, insomnia, difficulty concentrating, avoidance of men, and emotional numbing, she appears to be in the acute stage of rape trauma syndrome. According to Kanel, 2023, symptoms in this stage often include shock, fear, denial, sleep disturbances, and emotional disorganization. Survivors in the acute phase may report anxiety, disrupted daily functioning, and overwhelming fear of recurrence. Our goal is to ensure Kayla's emotional and physical safety without pressuring her. I would begin by validating her courage in disclosing the trauma. I would assess for suicidal ideation, create a safety plan, and offer options such as access to an advocate or women's shelter, but emphasize that the choice is hers. Support without pressure. Empower without forcing. You're not required to report anything today. You have control over what happens next. In California, where I practice, licensed mental health professionals are not mandated to report sexual assault if the adult victim does not want to report, unless there's a danger to self or others, or the assault involves a minor or dependent adult. Everything you tell me is confidential, unless I believe you're at risk of hurting yourself or someone else, or if a minor is involved. If you choose to report, I can support you every step of the way. Inform, don't force. Clarify, don't coerce. 2 trauma-informed strategies I would use are: 1. Empowerment through informed consent. I would give Kayla information on her rights, resources, and options without pushing her toward any specific action. And 2. Creating safety through predictability. I would always ask permission before asking sensitive questions and let her know what to expect in every step of the session. Cases like this are emotionally challenging. As someone who values justice deeply, I may feel anger or sadness on Kayla's behalf. However, I must be careful not to project those feelings onto her or rush her into a decision to report. I would seek clinical supervision and check in with my own emotional boundaries to ensure I remain client-centered and not emotionally reactive. Kayla is offered a follow-up appointment, given resource contacts for a rape crisis center, and leaves knowing she has been heard and respected. Healing begins when survivors are believed, respected, and given control over their own story. References: Kanel, K. 2023. A Guide to Crisis Intervention, 6th edition. Sengaj Learning, California Penal Code Section 11, 1160. Reporting Requirements for Health Professionals, National Sexual Violence Resource Center, NSVRC. ND. Trauma-Informed Practice.